Hello, my name is Julie Martin, and I am the Site Clerkship Director for Pediatrics here in Athens. Today I'll be discussing how to give effective feedback to students. The objectives for today's talk including outlining steps necessary for giving effective feedback and then providing specific strategies for offering feedback. There are three important steps to effective feedback. The first is setting expectations and making this very clear and explicit. The second is providing and observing opportunities of the student performing the task, and the last is discussing the learner's hits and misses. Evaluating students and giving feedback can feel very daunting, so I'd like to set the stage for what our goals ultimately are. First of all, I think it's important to keep the end goal in mind, which is helping train future doctors of America to provide the best health care possible. The second point I'd like to highlight is that recognition of student effort towards positive change is empowering and promotes a culture of learning. And lastly, the fact that frequent and directive, kind feedback is powerful and effective. At the onset, it's very important to give clear expectations. Students should be given opportunities to evaluate patients independently and should be required to formulate their own assessments and plans. When you set expectations, it's important to be very specific. For example, which patients should the student see? How long should they spend with the patients? What information should they present to you, etc. After setting clear expectations, it's important to provide as many opportunities as possible for the student to perform the task and then to observe the student performing the task. The final step in the feedback cycle is actually giving feedback. When you give feedback, it should be frequent, daily, and ideally with each patient seen. It should be brief, limited to 1 to 2 points. It's important that you tell students that you are giving them feedback, as otherwise sometimes students feel that they've never been given feedback. Acknowledge something that they've done well, and then list a positive change that you'd like to see in the future. The following are some examples of giving feedback to students. I'd like to give you some feedback. Good job with the organization of your presentation. Next time, I'd like to see you expand your differential to include at least 3 problems. Or, in terms of feedback, I appreciate the way that you asked about the detailed cardiac symptoms. Next time, make sure to listen to the heart in the sitting and supine positions to better characterize the murmur. Finally, I'd like to share some general principles that are helpful in giving feedback. These include be an ally, be constructive, be direct, be specific, be timely, as close as possible to the interaction. Finally, I'd like to review the feedback cycle one more time. First, set expectations and be as clear as possible. Next, provide and observe opportunities of the student performing the task. And lastly, discuss the learner's hits and misses. For those of you who would like to read further on the subject of giving feedback to students in the clinical setting, I have provided the following references. Thank you very much.